Father, you have created a world that is beautiful, but we also see the marks of mistakes in this world, of sin in this world, of disease in this world. But we know that you have something better for us. And so we're praying for you to be able to be here to lead and to guide us into wisdom and knowledge, that we may be able to take what you give to us and share it with others, that they may experience health. Bless our talk now by your very presence, that we desire you to be here with us in Christ. Amen. So, yes, prevention, staying inside. So that would be great. But if you stay inside, then you don't get any sunshine, and then your vitamin D goes down, and then you're sick. So we got to come up with something else. So ticks, they're everywhere. Are there ones that we should be more concerned with and less concerned with? Yes, there is. When we talk about disease, which ticks are we more concerned about? Deer ticks, right? Oh, Lone Star more so in the Lone Star State, believe it or not, down more towards Texas. There have been a few cases of that reported up here. So you're right. We should be concerned about that. The primary one that we're concerned about, though, is the one that is upper left-hand corner. It's the black-legged tick. Okay, this is the deer tick. Now you'll see there's other ticks up there, right? There's the brown dog tick, Gulf Coast. There is the Lone Star tick, which has a little white spot on the back. Texas kind of amplified that into a star and made that the Lone Star tick, right? But the one that we're really concerned about in Maine, specifically in the Northeast, is the black-legged tick. So it's really important. The first thing that you want to do is you want to be aware which ticks carry more disease. So what does the black-legged tick carry? Lyme, right? Any other diseases other than Lyme? Babesiosis, okay, or babesia, which becomes babesiosis. Any other diseases that you've heard of? Bartonella, right? Anaplasmosis, or anaplasma, ehrlichiosis, Francisella. There's a number of diseases, and the more we study, the more we find out. So I know Lyme gets the spotlight. Lyme is the big one, but believe it or not, we're starting to see a lot more co-infections. I actually am in the process of treating somebody in my clinic now that has four. The big ones that we just talked about: Lyme, Babesia, Anaplasma, and Bartonella. And these can be very, very difficult to treat. So you want to think about, okay, this is the one that we're after, is the black leg tick, but you want to realize also you might never see him, right? If you take a look at the tick cycle, right? And you've got a larva, you've got a nymph, you've got an adult male, adult female, and this gives you the spectrum, the size. And the problem is when they're really, really little, especially in May time frame, right? When they're nymph or the larva stage, which is even smaller, they are really little. You get an idea. This is a dime. You see the dime in the back? This is the size of the animal you're talking about. So when somebody says, well, I didn't see any ticks on me, I don't think I could have a tick-borne disease, right? You can see how easily you could miss this because if this is in your hair, you're not going to catch this, right? And the high time for this to happen really is May, June are really the big ones. And it tapers down a bit. It's still high in the summertime. Are you checking your hair now? It gets pretty itchy, doesn't it? So the high time is through the summer, tapers down in October. You usually don't see much disease in November, December, January, February, March, April, but then it tapers up at that point pretty significantly. But you can see we're dealing with size here. And the problem is when you take a look at these are very small, and in May, June, they start to go to the adult phase. So you start going from the larva to the nymph, then the adult male, okay, and the adult female. And you can see the adult female is a little different. The adult female, all the way over to your right, has a little orange swath on the back. And when these get engorged, that orange swath can turn kind of a tannish color. Okay, so it'll be a little bit different. So thinking that you're going to catch these is pretty bold because they're very, very small. Now, this is just one of the diseases. This is off the CDC website, right? And these are the diseases that they've so far associated with these ticks that we have here. And I named a few, but look at this: Colorado tick fever, ehrlichiosis, Heartland disease, Lyme, Powassan disease, rickettsia, Rocky Mountain spotted fever. There's a lot of different things. So when somebody says, okay, you tested negative for Lyme, the next thing that you should say is, okay, great, but that doesn't mean it's not a tick-borne illness, right? No, they absolutely do not. In fact, this is the challenge right now is these are really can be expensive tests. And so a lot of times what you want to think about is what are the symptoms of what I'm dealing with, which would lead to some of the testing that I'm going to do. Part of the talk that we're talking about today is realize that there are, in case anybody didn't notice, there are little divisions in our country right now, right? People look at things a little bit differently, correct? A lot differently. And that division is also in medicine right now. There are some big divides in medicine. There's more of a conventional approach, which says Lyme is not that big of a deal right now. We don't really have that huge in numbers, and it's easily treated with a short course of antibiotics. There are many doctors who've been taught that. There are many schools that continue to teach that. There are also other schools that would teach more of an alternative approach, which is you can treat without antibiotics. And Lyme is a chronic disease. There are debates here. My suggestion right now is for us to just become wise in studying both sides and making sure that we're getting the accurate information. That's how Adventism was created. That's the beauty of Adventism is we took all of this information and we said, let's really study this and find out what's true. And so I'm going to encourage us to do that here because we are going to talk about the diseases. We're going to talk about how you would treat. We're going to talk about how you do a workup and prevention. Okay, so on these are the major co-infections that we see with Lyme. It's not just Lyme, we see these as well. Now, what is Lyme? You hear Lyme, what's Lyme? Is it a bug? What is Lyme? It's a disease. I love that. Who said that? That was very good. All right, what's the shape of Lyme? Anybody ever seen a corkscrew? The shape of a corkscrew? That's the shape of Lyme. Lyme is corkscrew shaped bacteria that acts like a parasite. It's really fascinating. And it's very, very complex. And the problem is with that corkscrew design, what do you use a corkscrew for? A bottle to do what? To close it or really to open, right? If I've got a cork in the bottle, what do I do with the corkscrew? I screw it into the cork, right? And then what do I do at that point? It's in the cork and I can pull, right? This is what Lyme does to tissue in us. Lyme gets into our tissue, and that corkscrew design is very, very effective at getting into tissue. Now, Lyme as a bacteria doesn't act like a lot of different bacterias. Bacteria that you're commonly used to live to repopulate, they grow, and they destroy a lot of the tissue irreplaceably. Lyme doesn't. Lyme goes to areas in your body where you've had previous injury, and it's quite content to grow slowly. It doesn't repopulate quickly and it eats tissue, specifically a lot of times connective tissue, collagen, right? Sometimes nerve. It eats tissue that doesn't grow quickly, right? So think about all the places that you hear Lyme. Where does Lyme go as a disease? Where have you heard of Lyme going? Joints, perfect. Where else? So joint pain, generally if you get joints, it'll be one joint, it'll be quite swollen, quite red. Where else does Lyme go? It does go to your brain, right? And you can have a Lyme meningitis, which is inflammation there. You can have problems within the brain. Where else does it go? Anybody heard of Lyme carditis? It'll go to your heart, right? And problems with nerves. All of those are slow growing tissues, right? So Lyme goes to areas where the tissues grow slowly. So if you have some of those areas and they're chronic and you can't figure out what's going on and you haven't had an injury, you really need to think to yourself, this could be Lyme disease, right? The problem is that some of these co-infections also are very important. Now, anaplasmosis and babesiosis are interesting because these are actually more parasitic, right? Babesiosis specifically is very much like malaria. It gets into your red blood cell, and it's a parasite in your red blood cell and can do damage to your blood cells and to your liver, right? You'll have intense night sweats if this happens. Sometimes you'll have liver pain. You can have a dry cough. Each one of these have unique symptoms. Anaplasmosis, instead of attacking red blood cells, anaplasmosis attacks white blood cells. Okay? And you can see Bartonella attacks red blood cells. These are blood-borne pathogens that are really, really hard to get a hold of. Bartonella is a little bit easier to cure, but most of these are very difficult, and your body will react to them quite strongly. Oh, I'm sorry. Did you want to get a picture? There you go. Get a picture. Okay. All right. So the interesting thing about this is that we see that this disease is growing. So you can say, well, I didn't grow up with this. It can't be that bad. right? If you take a look at this, this is interesting. This is the reported cases. Now, it's not Lyme's disease, it's Lyme disease. It was named after Lyme, Connecticut, which is where it was first reported, right? And you can see the growth. You see all the blue dots? This is the growth that's been reported from 1996 to 2014. And it just so happens that the Northeast, if you take a look at this, this is from 2001 to 2011, if you will, and up to 2022. And these are the hot spots currently. And does anybody recognize one of the hot spots there? Right? We're right in the heart of it, right? In fact, Maine is one of the hottest places, if not the most severe place for Lyme disease that we're aware of in the world. So it's a popular thing for Maine, but not such a great thing for Maine, right? So one out of every 52 people, right? When you take a look at 100,000, will have Lyme disease. It's a tremendous number. So the potential for you having Lyme disease is actually very, very high. And you look at it's right in this mid-coast area is that is that red band where most of it is. It's right where we live, right? And you can see these that and in Maine, if you take a look at all the way over to the right, I don't know if you can see this. It says 2022, right? And this is total cases per 100,000 people. Do you see anything unique about Maine there? Almost 200 cases per 100,000 people, right? Maine has a tremendous problem with Lyme right now. Now, this hits all different age groups. A lot of this, it tapers off 80s and 90s, but this gets back to our comment. That person's probably staying inside a little bit more, right? And what's interesting that we've seen is that there's a huge difference between confirmed cases and probable cases. And what you'll notice is that each time we change the definition of Lyme disease and we make it more accurate from 2007 to 2008 and then 2021 to 22, we realize that the cases were much higher than we thought. And so we're way underestimating cases. Now, this is interesting. That's right. This is 320,000 people are diagnosed with Lyme disease annually. That's a huge amount of people. And again, a majority of them are going to be in the Northeast. But the problem is updated as of 2022. You see the bottom one? It's an estimated that almost 500,000 people are going to have Lyme per year, right? And you put that in case of other things. How many people die of heart disease a year? Well, about 600 to 700,000 people. So Lyme, right, is something that when you hear people having heart disease, which is not uncommon, Lyme is very common. Goal in a lot of this is just try to get it into your mind that Lyme is something you really want to look at. It's way more common than we thought it was, right? We've underestimated tremendously. Now, where do Lyme, where do these deer ticks come from? Not just deer, right? So if you take a look at these, is it from squirrel, from deer, from turkeys, from birds? Any other ideas where they come from? Right? There's some birds with ticks on them. Well, unfortunately, they come from a lot of our favorite pets too, right? And people who say, "Oh, I love to sleep with my cat. I love to sleep with my dog." That's great, but if that dog is outside, if that cat is outside, a lot of times what happens is that the cat or the dog, right? If you have a pet deer too, I guess. But if the cat and the dog is outside and they have a tick crawling on them and they come in and they're sleeping with you, the potential for you to have that tick come onto your body is quite high, right? So it's something you want to think about as far as what's a proper way to do this. I don't want to make anybody frustrated with their cats or dogs, but this is a major transmission vector, right? Now, this is unpopular, but it's true. There have been diagnosed cases of Lyme disease with mosquitoes, right? Mosquitoes do transmit. They're getting into the bloodstream of one animal, they're getting into a bloodstream of another animal. It is less common. But again, do you see the point? Just because you never saw the deer tick doesn't mean you don't have Lyme disease. Okay. So this is interesting because we continue to grow more. There's different types. You'll hear Borrelia. Borrelia is kind of the family name of Lyme disease, if you will. But you see, there's all these different kinds. The one in the United States is Burgdorferi, which is the first one. But there's other ones on there, and they're growing in strains. Every year, we learn more about more Lyme disease strains. And here's the scary part: is when you take a look at these, you think, well, how quick does it get through my body? This is the problem. When the tick bites you, currently the CDC says that it takes 24 hours for transmission. Now, the problem is there's no solid data to back that. And I'm not trying to say don't trust the CDC or not. I'm trying not to make that distinction. I'm just saying let's look at the data. What we do have data is we have documented cases of Lyme disease transmitting in 4 hours, right? So 24 hours is not a safe thing if you look online and you think I'm okay. And here's why. What this is movement through the vascular wall. I want you to take a look at in this is that if Lyme gets into your bloodstream, it takes about 11 minutes for Lyme to get through your blood vessel and get into your tissue. 11 minutes, right? So the potential for it to get in and then to move through your body is tremendous. And it's because of that corkscrew design. It's very effective at getting into tissue. That's a spirochete here. This was a certain way that they caught it. That was kind of tough. What's interesting about this is that we think of, from an evolutionary standpoint, you think of, oh, it was just stupid things that were simple, and then it miraculously evolved into things that were complex. But what we're learning about these is that these simple bacteria are incredibly complex, right? 975 million base pairs. That's 1/4 of what we have in a little bacteria. And what's interesting thing about this is that this is much more capable about evading certain medications and getting into the bloodstream and having a capacity to hide itself than we ever thought before, right? It used to be up there and it says syphilis only has 7. Why does it say that? Because syphilis was also a spirochete, and syphilis, when it infected, would mimic other diseases. And now Lyme is the one that's mimicking other diseases. So if you have heart problems, could be Lyme, right? If you have memory problems, could be Lyme. If you have fatigue problems, could be Lyme, right? If you have nerve issues or joint issues. And so what's important about this is the treatment has to respond to this. I want to just kind of read this. It says, this is one of the most unusual genomes on the planet. As we grow in time, it seems that disease is becoming more aggressive and more difficult. When they studied this, they said no other bacteria have such a large complement of extra chromosomal elements. They perform uncommon processes known as telomere resolution that can explain the wide range of variability in linear plasmid size, content, and sequencing. But let's go into symptoms, all right, specific symptoms. So, who knows what a erythema migrans rash is? You've heard it called a what? Or a bullseye. It's called a bullseye rash. Okay, so this is a giveaway, but this is only 30% to maybe 70% of the cases. And that bullseye rash, it's interesting. It'll start small. It'll just be red. It'll have a light, slightly raised red border, right? And it will grow. Okay, and it will start to get pale in the center and grow out. And if you have one of these, this is very unique to Lyme disease, and you want to really get it checked out and treated fairly quickly. It can have gradual onset, flu-like, multi-system. We talked about that. Brain fog is huge, and what that means is I just don't think that I can think clearly. I'm forgetting things more often, and it's not just getting older, right? It's a change from your normal baseline, right? This is an important one. Migratory joint pain. Lyme classically will affect big joints. It will go usually in the knee. It can go into the hip. It can go into your back. But what I see usually is I usually see ankle, I see knee, I see elbow, I see a lot of times TMJ. Okay. So it will go to different places and then it will resolve and you think, okay, everything's better. And then it will go to another joint, right? So really classic for Lyme. Arthritis, I mean, this sounds like a list of what we commonly have anyway, but you can see a lot of these. What would you really focus on? Well, some of these you'll have, some of these you won't. A lot of times, if you're younger than 30, actually the presenting symptoms can be dizziness. Presenting symptoms can be more electronic sensations in your brain. There are two things that I want you to remember that are really important for Lyme that you're always going to have. Number one is you're always going to have fatigue. And I mean significant fatigue, like I can't get out of bed kind of fatigue, right? And the second thing you're going to have is you're going to have an intermittent fever. It's going to go up and it's going to go down. It's not going to be super high. It'll be no more than about 102, but it'll come on a lot of times worse at night, and then it'll get better, and then it'll come back. If you have those two consistent symptoms, you really need to think about this could be and likely could be tick-borne. Okay? Those are the two cardinals that you'll always see. The rest of these, sometimes you'll see them, sometimes you will not. There is the rash and what the rash look like. Okay? Now, this says CDC 31% absent. Great, but I've seen other sources up to 70%. So just because you don't have this does not mean you don't have Lyme disease. Okay? But that's what it will look like. And again, it will expand out. Okay? So on this, we don't need to talk about that. On testing. Okay, this I do want to talk about. Um, this is the difficulty with Lyme and where we are right now. And again, I would talk about this even in Adventist circles. I try to bring this up. What's the problem with modern medicine? How much does modern medicine rely on prevention and lifestyle? It doesn't, right? And so we've got a more diseased population than we've ever had, and we have a medical establishment, and don't hear me talking bad, but a medical establishment that's really focused on drug treatment. If drug treatment is working, we should be the healthiest country in the world because we spend more money on drugs than any other world. And in fact, more than combined several other countries, but we're not healthier. So it's the same thing here with Lyme disease. There is a contention between how to treat. And I have two here. You have International Lyme Associated Disease Society. That's the one on the right. You have Infectious Disease Society of America. That's the one on the left. The one on the left is more of a conservative approach, more of a conventional approach. The one on the right is more of an alternative approach. Now, I don't mean alternative meaning bad. I'm just saying a lot of times they're looking at different data. But you can see why it's so underrepresented. The diagnosis requires a rash. Well, the CD just said a third of the cases won't have it. And you might not see it. What if it's on your back? You don't ever see it. No one didn't check for you, right? And or two positive lab tests. Wow. So the bar is pretty high, right? Versus, right, more of a alternative approach. Lyme disease is a clinical diagnosis, and it needs to be because you really need to go through these symptoms. Now, online, and you should think about this if you're questioning it, there's a Horowitz scale. Dr. Horowitz created a scale that is a bunch of questions that you can take. And if you're high on those, the chances of you having Lyme disease are quite high or tick-borne, right? So Lyme disease is effectively treated by a short course of antibiotics on the left. So that's the treatment, right? Let's talk about that for a little bit. Has anybody had Lyme disease or had antibiotics already? Okay, what did they give you? Doxycycline, I'm going to assume? Bartonella or Babesia? Okay, Bartonella. Okay. Bartonella does treat well with doxycycline. Now, I want to talk about Lyme specific. How long does Lyme live as a bacteria? All bacteria, they're just like the rest of us. They're born and they die. What's the life cycle of a Lyme bacteria? Any guesses? What's that? No idea. 5 weeks. About 5 weeks. Okay. The problem is that the recommended course of antibiotics is 21 days. Now, if you're killing the bug, that's okay. But the problem with doxycycline, specifically for Lyme, is it doesn't kill it. It just prevents it from reproducing. Which means for 3 weeks, you're saying to that Lyme bug, you can't reproduce. Great. And but it lives past that. So the problem is with our current treatment model is that we're not allowing enough treatment time if you're going to use doxy to be able to effectively treat. Why would you use doxycycline? Because it's good for Bartonella, and it's good for anaplasma, and it's good for ehrlichiosis, but it's not good for Babesia. Babesia is like a malaria, so you need to use like more of an anti-malarial approach for that. Okay. Well, they're testing you for malaria-like, and this would be one. Babesia is a malarial-like disease. So you can see that if you treat, and they're like, you treated, you got antibiotics, you're fine, and you'll feel better. But that this Lyme is continuing to produce, and it's in your body. So what would be a good consideration is if you're going to treat with doxycycline, first of all, it's a very strong antibiotic. You need to have some kind of probiotic afterwards, and preferably during. And a lot of the recommendations now, which I prescribe to, is you need to treat for 6 weeks. You need to treat for the entire life cycle of the bug that you're trying to treat. When you do that, you get much higher success rates. You could be asking yourself, do you need to treat with antibiotics? We'll get to that in a little bit. But let's finish with this. All right, so it's saying short course of antibiotics. And the other one is saying, well, it should be continuing until all the symptoms have subsided and any infections of the disease are gone. Again, that can be tough. Then you could be on antibiotics for years. So you have to be thoughtful about both of these approaches and say to yourself, where do I fit on that spectrum? Right? The last one here, is post-treatment Lyme disease syndrome. A lot of times there's no belief that Lyme disease continues. But if you talk to the bacteriologists and you ask them, do other spirochetes like syphilis or leptospirosis, were they chronic? Well, of course they're chronic. The bacteria doesn't go away. So Lyme is a spirochete. Does it go away? No. So the concept that you could have chronic Lyme, absolutely you can. They're having a hard time explaining it. This is one of the new ones that they've come up with is post-treatment Lyme disease syndrome, saying that mostly they believe that it can't continue, but the bacteriologists are arguing against that. So again, realize there's two different viewpoints, and it depends on the doctor you go to on what that doctor is going to say to you. And so you're going to get one viewpoint or another. You may get combined, but just realize that in this, there's not a real straight answer for Lyme about this is what it is and this is the way you treat. So it's one of those areas that you have to get smart in for yourself and being able to treat well. So what do I do as far as trying to help avoid this? This gets back to prevention. So if we're not going to stay inside all day, right, what do we do? Well, this is one of the big things that really is important. Routinely do tick checks. And tick checks are going to be you check your whole body when you come in from a hike, right? Ticks will crawl until they really can't anymore, and they'll try to get into a point where there's some kind of boundary. And that boundary will often be belt line, that boundary can be sock line, right? So when you come in from a hike, you want to actually kind of strip off and you want to do a complete body check. And a lot of times, what I'll do is you rub your hands because you can feel if something like a speck of dirt, something small, is attached, right? And you'll catch it, right? If you're married or parents or kids, you have somebody that can check appropriately as well because you can a lot of times see them on your back. And then the last part is really spend some time in your hair and spend some time making sure that you're doing a really good job. I did this with my son and my daughter when they were young, and it was head rub time, right? So they'd come and they'd sit in front of me and you just rub and you try to make it enjoyable for them. But it's a good way to do ticks. So if you got young people, that may be something that's more fun. Okay. We talked this before is that the CDC states that a tick must be attached for 24 to 48 hours. The thought process being is they take blood in, when they regurgitate and pull it out, that's when Lyme disease happens. Too many cases that are confirmed way beneath this. If you have a tick that's engorged, your potential for Lyme disease is absolutely possible. Okay? All right? There are healthy natural tick repellents. I put on some up here, the ones that have some good information behind them. Natural cedar oil or cedar side is the name of one product. It's quite good. Cistus tea or rock rose tea, Cistus incanus, was used in a study in England with dogs, and the dogs that were drinking this tea came back with a lot less ticks. Realize ticks have taste buds. Well, not really, but they have taste buds kind of like we do, and they like certain things. And it turns out that people that have certain smells or higher sugar diets, it appears, are more attractive for ticks for some reason. So you want to make yourself ugly when it comes to ticks, right? And so there are some good ways to do this. Okay. The next thing, what do you do if you got a tick embedded? What have you heard? What do you do if you find a tick embedded? How do you pull them out? Tweezers. Where do you put the tweezers? Try to get the head out. So I love that. Yeah, that's really good. A lot of people don't. And I will tell you, probably during tick season, once a month, I'll dig a tick out of somebody, right? Realize that the body can come off easily from the head. And if you're going towards just the body and not towards the skin, a lot of times the head remains embedded, which then creates another infection as that starts to decay. So be very careful how you pull them out. I recommend a thing called ticked off. It's just a plastic scoop. It's got a little V in the middle of that scoop, and the tick is here. And you come, if the tick is embedded, you come in and you grab the teeth of the tick, if you will, where it's embedded, and then you've got the tick. Now you've got the tick. What do you do with it? Save it. Flush it down the toilet, you think? No, yes. Get rid of it. Save it. Why? And a lot of people don't know that, so that's really good. You can have the tick tested. The tick testing is much cheaper than human testing. And then you know, is the tick infected with certain diseases? University of Maine has a program, the extension program does. There's Tick Report out of Massachusetts. There's several areas you can get them. So check online and get the tick tested first. If the tick's positive, then you know that you've got more of a risk for you. And the nice thing is they'll do co-infection testing as well. So you can get an idea of, am I just dealing with Lyme or are there other things that I might be dealing with? Okay. And then finally, I put down here, you're going to have to just spend some time on this. Find somebody who's knowledgeable about Lyme. I will tell you, in med school, how many hours of nutrition class do you think that we got in med school? That's really, did somebody tell you that? Okay, yeah, 4. That's what we get. We get 4 hours of nutrition, right? So you come out of med school and you think, "Ah, nutrition." I've had GI docs tell me, "It doesn't matter what you eat. It doesn't matter if you drink Coke or not. I mean, you're gonna get disease, you're not. It's just the body processes it." So just realize that the information out there, not all of it's great, right? How much information do we get on Lyme disease? Not much, right? You know that it's a bacteria. You're taught that the best thing that you can use for the co-infectious is doxycycline. You're taught that the Infectious Disease Society of America tells you use it for a max of 3 weeks. If you just got it initially, use it for 2 days, and then you're done. And anybody who says you have Lyme after is probably making something else up, and you need to examine that, but it's probably not Lyme. That's what I was taught. That's blatantly wrong, right? So just realize in med school, and again, I'm not trying to make fun of med schools, 50% of what they teach you in med school in about 15 years is taught to be inaccurate. Whoa, you're paying a lot of money for 50%, right? So just realize that your doc may be doing the best job that they know how to do, but they may be dealing with sometimes bad information. Okay? So you'll want to ask questions. Find somebody who's knowledgeable about how to treat. That's the bottom line. Okay, this is that Horowitz scale. If you want to get a picture of that, this will go through a bunch of different questions, and this is useful. If you score high on this, the potential of you having a tick-borne illness is quite high. You can get this on a PDF online, quite easy to get, very useful, and take that to your doctor and say, "Listen, this has been checked. I want some testing." Okay, all right. So looks like I'm not getting such a good thing on this, isn't it? All right. So what are some things that you can do to build your immune system? Right? It's interesting. It comes back to this, and I feel like in my practice, a lot of times I'm a broken record this way. The 8 naturals work. They work over and over and over. And so if you go through this with somebody that you know, this is an entryway for you to be able to talk about the principles of health. And if you're having a problem in your own life, this is a great time for you to pray and say, what am I not doing? And one of them, oddly enough, that I see, what's the 8 naturals that you think is broken the most? Exercise, okay, that's a big one. What else? Diet, okay. All right. What else? Sleep. And you said rest. Okay, so sleep. What do you mean by rest? Trust in God? Well, that one, yeah, you're right. What do you mean by rest? Time off. What I see, one of the biggest things that impacts the immune system is stress. And our society is tremendously stressed. And when your stress level rises, your immune system decreases. So your capacity to fight illness actually goes way down. Okay? So we've talked about different things as far as what works as far as antibiotics. I want to switch gears a little bit and talk about some other natural remedies. Okay? Don't think to yourself that we're just switching antibiotics for herbs, right? That would be a mistake. There are other treatments that work really well. Do you want to guess what the best treatment that I've ever seen work on Lyme disease is? Hydrotherapy. How so? What do you mean by hydrotherapy? So just pour water on somebody? I love where you're going. I just want you to amplify. Hot and cold. And that's contrast. And contrast can be very good for the immune system. But what's interesting about Lyme disease and a lot of these other ones is that Lyme disease dies completely at about 106 degrees, right? 106 degrees. So then you have to ask yourself, why do we have a fever when these things happen? Why a fever? So is a fever a bad thing? Can be if it's super high, but a fever, a lot of times in medicine, you're taking Advil or you're taking Tylenol to decrease the fever. So this is a really good point. 106 is very high because at 107 you start to denature proteins. It's not a good thing. So 106 is completely labile. There are some places in Germany that were taking people up to 106 body core temperature very slowly with dry heat, not water, because water is a little too powerful. And they were having tremendous success rates with Lyme. But we can use some of this naturally as well. And I'll tell you some of the best treatments that I've seen in Weimar did this when I was at Weimar. There's some other places in Germany that are doing this, is using what's called a fever bath. And it's not hot and cold. This is interesting. When you're dealing with Lyme and you're trying to kill bacteria or some of these other bacteria, it's heat, right? And so what you want is you want to get into what's called a fever bath. And a fever bath is an artificial fever that's induced by hot water. And so you get into a bath, and don't ever try this alone. You need somebody to help you with this. But you get into a tub of water up to about your neck, and you slowly raise your body temperature up. The water temperature should be around 108, so a little warmer than a hot tub, but not by no means scalding, right? And you slowly raise your temperature up to about 102 and a half to 103 and a half, not 106, right? 106 is too high. And this sounds like, oh, that's easy to do. If anyone's done it, it's not easy to do. It's really hard on your body. What's amazing about this is that you get tremendous die-off. So you're going to actually not feel so great afterwards. But the best results that I've seen in numerous places have been with people who are doing this consistently. I recommend about 3 times a week. That's very hard. It's a day on, a day off, a day on for that initial portion of that 5 weeks of Lyme disease. Now, an important point, you'd have to have a cool rag on your head, right? You don't want that heat constantly going to your brain. And it's not as effective as 106, but it's very effective and it's not drugs. Saunas are really good too, and saunas can be very helpful. But the sauna generally is not going to get your core temperature up the way that water does because water is a better conductor of heat than air is, right? And you can generally insulate. If you don't have the capacity to do a fever bath, a sauna will help. Anything that you can get your body up is helping, which is why a lot of times on fevers, you don't want to bring a fever down unless you have cause. If a fever's too high and you're starting to get, there are febrile seizures, there are problems with something that you can start to denature if you get too high. A high fever can be a very dangerous thing. A low fever is your body's response trying to deal with the virus or the bacteria. And that a lot of times you want to augment. So, yes, you can do that. A note, if you're going to do a sauna, you got to wash afterwards. It's interesting. I don't know if you remember, but Kim read this today, and it's an Ellen White quote talking about cleanliness. But she said, you need to wash your clothes so you don't reabsorb the impurities. What's amazing about that is there was just a study that was done a few years ago on saunas. That if you do a sauna and you sweat out things like heavy metals and toxins, if you don't shower, your body just reabsorbs them, right? So important on that. And then there's certain times that you wouldn't shower, like if you go to the beach and you're out in the sun and you've been out in the sun for a period of time and you're getting vitamin D, don't come home and shower immediately. The vitamin D is going to continue to absorb for a period of time. Give it a few hours to absorb. And then at that point, it's a good time to shower. So, to your question, saunas are good, but you're not going to get the core temperature up to where you need. So, one here and one in the back. Oh, so really good question. How long for the fever baths? What I try to do is remember it's gentle, it's what you can do. So a lot of times you'll do the water for a while, you bring the water in, slowly bring the temperature up, see how the person's doing. I check heart rate, right? I check blood pressure, I check their temperature and make sure they're doing okay. If it's too much, I bring it back down. Okay. The ideal, if you will, is to try to get somebody in where they're slowly brought up to a core temperature of about 102 and a half to 103 and a half over about 20 minutes, maybe 25. They stay in that window for up to about 30, maybe 45 minutes, depending on the individual. And that may be too much. That's a pretty big ask. Sometimes it's just 5 minutes, and then maybe you do 10 minutes. You stay in that window for a while, and then depending on symptoms, you taper it down slowly. The danger part of fever baths are going to be if the person needs to get out quickly, if they're that hot and they try to get out quickly, you can lose a lot of blood flow or you can pass out. So you need somebody there to help them get in and get out. And you need somebody constantly getting their core temperature, the water temperature, and cooling their head. Okay? But to your question, the ideal around 30 minutes if you can stay in that zone. Okay? One in the back and then one here. Yes. Thanks, Kim. Right. Right. And that's the ideal. I have from a doctoring standpoint, I have to make sure that I'm being very careful in how I do it. At home, you definitely want somebody there to watch you. Yes, it can, but if you've got Lyme carditis, I want that area heated. And so that can be tough. You're right. That can help with somebody to stay in there longer. And if it does help, but the ideal is I want them in their neck for about 25 minutes at that temperature to get the best potential for Lyme die-off. When this happens, your body's going to react. And that next day, you're not going to feel so great. But the people that have done this have had complete recovery. that have done. I worked with a guy in Tennessee um, most recently that did this consistently, and he did the protocol that I had said. It's gone, and it hasn't come back. Right? Check their vitals. Yep. Three things that are important is that you want to check the temperature of the water. The water needs to stay from about 108 to 110. The temperature of the individual, right, along with their vitals, right, and making sure that their head stays cool. Those are the three areas that you really want to focus on. Sir, cooling down is about 20 minutes as well. It depends on the individual, but generally the cooling down process is better. And we've had some people within our health ministries group, they use a wool blanket in the water to keep that core temperature, higher. So it depends on the individual. You have to look at what the individual can handle. Some people can handle more heat. Some people, when they're really sick, cannot. Yep. I don't want them to cool down at that point in the sense that when they do that, I stop bringing hot water in because you're constantly bringing hot water in to do this. You stop that hot water, right? You allow the water to kind of normalize a little bit. You can have the person after about 10 or 15 minutes kind of get up out of the water and sit. But I'm not adding cold at this point because cold will undo some of the thermodynamics that happen to kill the bacteria. So this is more specific towards killing the bacteria. If I want to stimulate the immune system, that would be more of a contrast, right? Hot and cold to try to stimulate the immune system. That's correct. Correct. Well, and that's correct. It's because your immune system is still coming in, so you're still killing off, just not completely all of them. So, but you are killing them, even at 102 to 103 and a half. You're still killing some. It's just not 100%, right? And so you're right. And this is the difficult thing that you deal with, which is why in Germany they went to 106. I don't think that that's a safe or a smart thing to do, especially to tell people to do at home. It's much too close to a danger area from a fever standpoint. But I've been very pleased with the results that I've seen for 102 to 103 and a half. Yes, correct. That's correct. Because remember that heat does other things. It allows your white blood cells to get more effectively into tissues and get out of the bloodstream, right? The heat shock proteins are very effective for helping the body to be able to overcome different bacteria. So it's not just killing it, it's making the immune system even more powerful. Okay. Well, she said the intelligent use of water. And so, I would like us to see us amplify what Ellen White said. And we think, okay, I'll just drink water. Well, A, what's your water in? Is your water in something that's leaching, right? Phytochemicals? Was your water tested? Does it have heavy metals in it? Intelligent use of water, is it just drinking it or are we using it here? So, really getting deeper into some of these principles of the eight naturals. She talks about fresh air. That's what we talked today. A lot of indoor air is very poisonous, right? So you really want to think about what does pure water look like? What does fresh air look like? What does a healthy diet now? Somebody will say, I'm vegan. And I say, well, that's great, but Oreo vegan. Does that mean you're eating Oreos? Or they'll say, I'm only eating kale. Well, is it organic? Because if it's not, then it's sprayed heavily with pesticides. And now, even though you thought you were eating something great, you're also getting a chemical that's hurting you as well. So, her encouragement from God was accurate. We just have to delve into it carefully still and making sure that it's the wise use of the eight naturals to be able to bring health. But good question, very good question. Okay. Now, these I bring up just because I think they're useful. This is actually, he's a master herbalist. Unfortunately, he's passed away, but probably one of the most intelligent books and treatises that I've seen on Lyme disease and some of the co-infections. His name is Stephen Uner, and he wrote about Lyme disease. But what I also like that he did is he wrote about co-infections, and he has co-infections. This one is for Bartonella mycoplasma, but he also has one for Babesia, right? And these will take you through the disease process, but they'll also take you through herbals that are thoughtfully applied. And I've seen them work over and over. So if you want an alternative approach and you want to read about this, some people this will put them to sleep, and some people this would be fascinating reading. But he's funny and he does a very good job and he's very well cited, meaning he doesn't just say things that he thinks, he cites different things to show that what he's saying is accurate. But as far as dealing with Lyme, I think he's one of the best people that I've read so far. Okay. So I did want to talk about this too, because this is interesting for the time that we live in, is you want to think that, and people will talk to me all the time, is I'm scared, I want to do antibiotics. Okay, well, you have to ask yourself, is antibiotics always the right choice? And I will tell you, sometimes I think it is. Antibiotics, if something is life threatening or life altering, I think you need to have a talk about antibiotics or antimalarials. But are there herbals that do well as also? And there are. This is fascinating. This is a study that was done in 2021. And this study is done, this is the Bay Area Foundation. There was another one done at Johns Hopkins. And this Bay Area, they studied three herbal medicines, right? They studied black walnut, cryptolepis, and Japanese knotweed. Now, what's fascinating about these is what they said was these had better effect against Lyme disease than doxycycline. So you sometimes think, well, herbs, yeah, they're inferior, right? But God has given us natural ways that are going to use, and these are three of the big ones. Now, black walnut's also very nice for fungal infections. So if you're dealing with any kind of yeast or fungal infection, that can be helpful. But then they also confirm these other two, which is skullcap, it's Chinese skullcap, and the other skullcap, but that both of these are very, very effective against both Borrelia and Babesia. So you also have some that are anti-malarials. So wow, you've got options out there now that have been studied, and they said these are actually better than antibiotics without the side effect profile. Now this is a Johns Hopkins study, which was 2020, and they confirmed this. This is the one that they went head to head with, and they said, okay, we want to test these, and the two that they tested, right, that were very effective in Babesia and Borrelia were Cryptolepis and Japanese knotweed. Now, the previous study in 2020, I talked to you about that. They talked about cat's claw, Chinese skullcap, a few of these other ones. But the ones that continue to come out are Cryptolepis and Japanese knotweed. So having these as an option, because there's not really a side effect profile that is in any way damaging that I've seen on any of these. And these are very effective for multiple different tick-borne illnesses, more effective than antibiotics. Why would we be concerned about antibiotics? What's the problem? Yeah, it's like, it's it's just this kind of bazooka approach to a fly. It's killing everything, right? And so the problem is that when you repopulate, the things that repopulate faster are generally the pathogenic or the bad bacteria. So this is a way for you to not lose a lot of your bacteria. Why do we need bacteria? Don't we want to kill all of them? What makes them good? Why are they good? Okay, they're part of our biome, but why are they good? There are bad ones that are part of our biome too. Yes, you need them for digestion, so absorption of nutrients. That's excellent. What else? This, what's that? Skin health. There are different bacteria components on different parts of your body. The ones in your ear, nose, throat are different from the ones in your skin, different from the ones in your upper gut, different from the lower ones in your lower gut, right? What's fascinating is that these help not only digest, they protect us from sunburn, right? What's also fascinating is they release certain hormones that make us feel good. Isn't that fascinating? It turns out that these good bugs are, in fact, good bugs for good reasons, and why you don't want to just, you know, indiscriminately kill all of them, right? Okay. So, yeah, go ahead. No, you need it more in a medicinal form. So on these, the question was, what form are you doing with the clove and with the other ones? These need to be um, refined for medicinal purposes, so they're highly potent. I like dry herb form a lot of times, and you can use those in teas. I also like tinctures. Now, this is a problem. Tinctures are the most potent that we're aware of from an herbal standpoint. Tinctures, the problem with tinctures is a lot of times they're made by definition with alcohol. And if you take a look at alcohol and the wisdom we've been given on that is we're supposed to avoid that because it is damaging, even small amounts. The difficulty with this is some of these, you can't get some of these herbs unless they're in tincture form. Or you can get them in glycerate form, or sometimes you can get them in dry form. You want to get them from a good distributor that you trust and somebody that does a good job of actually harvesting them and processing them. And so for your question, you would want this in a medicinal form. You'd want it more in a tinctured form. I try to use glycerates if I can. because they're safe for children and safe for adults. And usually the dosing, it depends on the recommendations. I've seen dosing anywhere from 2 times a day to 6 times a day, depending on what the recommendations are. Yes. On the knotweed, I'd have to take a look at that. I think it's the root, but I think they use some of the other medicinal components of it too. I mean, I know it's the root, but I think there's another component of the Japanese knotweed they use as well. Well, those are helpful because that's a local one, right? Some of these are not. Some of these are harder to get a hold of, right? Yeah, and they are expensive, and that's the downside, is that you have to ask yourself, antibiotics are much cheaper and they're much quicker, with much higher side effects. Herbs are more difficult to get a hold of, they're more expensive, they take longer with much less side effects. So it really has, you can see, this has to become kind of a personal decision on how are you going to treat. But my point in this is that you have options, great options here, right? So we're talking a little bit about the tests. I just want to kind of finish on this and then I'll throw it open to some questions. We're taught that these are the tests that you do, but we're not always taught why. The tests that often are run in hospitals or run in an outpatient setting are derived because the insurance company says it's the cheapest value for the money. It doesn't mean it's the best test. It also doesn't mean it's the best test if it's the most expensive. And there are certain companies like Igenix out in California, they do good testing, but they're outrageously expensive, right? And so what you want to do is you want to think about testing that A is effective for what you're trying to test and from a good lab. And they are reasonable pricing on some of these, but oftentimes the ones that are the best are not the ones you're going to get in hospitals, and they're not the ones that you're going to get in common outpatient settings. Just for your benefit, there are some labs that I like, and MDL is one of them. Medical Diagnostic Laboratories does a very nice job on tick testing, and they will save your blood for 30 days so that if something comes up negative, you can go back to them and say, okay, now test this and this, and it can save you some money. Vibrant America does some very good testing as well. There's a new lab out called Infecto Labs. I don't know much about them now. We're exploring some of those. And there's Igenix. From a Lyme disease standpoint, Western blot is the test that you generally want to start with, which is not the test that's recommended. That's the second test if the first one's positive. And the first one can be wrong a fair amount of time. That's an ELISA test. It's not always that accurate. Western blot is specific proteins from the Lyme disease that if you have those bands of proteins, the chance of you having Lyme are very high. And that's one of the most accurate that I've seen. And then there's another one called C6 that tests for more of a Asian component. So again, you can get wrapped around some of these tests. Make sure that you have somebody that's doing good tests. Western blot is generally the first good test to do. So if you want to talk to your primary care or other people, that would be the one that I would recommend you start with. And that's an IgM and an IgG test, meaning it's an immunoglobulin test that tests for your body's reactivity to Lyme. So I've done a lot of talking. I'm happy to take questions and thoughts now as far as what you might have to allow. So any questions? MDL is one, Medical Diagnostic Laboratories. Vibrant America is another one. I'm looking at Infecto Labs. I've heard a lot of good things about Infecto Labs, but I haven't really looked at them from Lyme yet. Igenix is the one out in California. And they're a good lab, but a lot of times they get bad publicity because they do pretty elaborate testing that's expensive. And because of their elaborate testing, a lot of times they'll come positive when other people are not. I don't think it's inaccurate. I just think they do better and more expensive testing. Igenix. It's yeah, Igenix. The letter I. Vibrant America is the full name of that one. And Infecto Labs was the other one. Now you can get some of these basic labs, like a Western blot, you can get that pretty much anywhere. That one's pretty straightforward. For the co-infection, I would go with the other ones. So questions on what you've heard from co-infections for Lyme, for ticks? Okay, go ahead. Mhm. Every other day, and you want a day off in between. 3 times a week is generally what I recommend. 3 times a week, every other day. and you rest on what's that? I like 6 weeks because you cover the life cycle of the Lyme. And then at that point, I start backing down generally to 2 a week and for a few weeks, and then one symptomatically. If the symptoms are still elevated, hold on that for a period of time. The problem is it naturally it takes some time to cure some of these diseases. And we are used to antibiotics where they say you'll feel better in 48 hours. Okay, but then I see people with problems with antibiotic associated GI issues for years afterwards, right? So we have to just be thoughtful about which approach we're going to take. And I've seen people that have taken antibiotics and done the 6 week course, Lyme is gone and they're fine. So I don't want to, again, start pointing fingers of this person's right, that person's wrong. There are options, and you need to pray about what option is going to be best for you. The GIs generally that I see is I see inability. So I see people that are gaining weight and that are malnourished. I see bloating a lot of times, pain after you eat. I see chronic issues with diarrhea versus constipation. Those are usually the issues that I see. And a lot of times I'm working with someone in the Amish community right now who's trying to get pregnant, and she has had a lot of dosing of antibiotics as a child, very hard time getting pregnant, and has had massive GI problems with alternating constipation and diarrhea. She can't get things down, and so it takes a while to rebuild that gut bacteria, right? So there are benefits to antibiotics. They work. They kill bugs. The downside is that the bugs are starting to get more resistant. So as we move forward, some of these antibiotics are not going to work. We're already seeing that, right? We haven't seen any resistance to any of these yet, and that's encouraging, right? Okay. So this was very gracious of you on a beautiful Sabbath to be inside. You protected yourself from, I don't know if you said it, but from ticks. That was very good. But I think it would be good for us to get out and to enjoy some time. Yes. Yes. That's a very good question. Given the fact that Lyme moves through tissue very well, that's a really hard question. I'd love to say to you, right, it's this. I think that the safe thing is if there's any potential for blood transmission, there's an opportunity for that to happen because part of the way that the tick gets in is that the tick is excreting things that destroy skin so that they can get into your blood, right? The potential for the tick to be able to excrete something that's into the blood at that time is there. Now, you're right. If you pull it out and it's just skin, chances of transmission is pretty low. If you pull it off and it's brown legged, well, they carry certain disease, but not much compared to the black leg. So some of it is what does the tick look like? The other one is how much was it attached, right? And those are the ones you take a look at. Even in that case, it might be wise for you to test the tick. If it was a black leg tick and you're not sure, test the tick. Yes. I love charcoal. What I actually use more so for skin than charcoal is I use bentonite clay. I find that bentonite clay has better pulling properties, I think, for skin and for restoration of skin than charcoal does. I love charcoal internally. I think it's wonderful, and it's also good externally. Don't get me wrong; you can use it, but as far as direct application, instead of trying to use, sometimes you'll use a covering in between. But if you use direct application, and then what I'll do is I'll put in something like golden seal and tea tree that I mix in with the bentonite. So you've got an antibacterial for staph and strep, and another antibacterial for the skin and the golden seal, and then you've got the pulling properties of the bentonite, and I'll leave that on there for about 30 to 45 minutes and then wash that off and do that a few times a day. So yes, great question and a great way to treat it. I will because I want to treat the surface infection, make sure that there's no surface infection, and I want to pull everything that I can from that skin site immediately. It's not, it's something you're gonna have to make individually. Um, no, the tea tree is an essential oil, and the golden seal you can get in capsules and you can actually break it open and put it in there. So you can get dried. Yep. Mhm.
I've read that a gray squirrel can be bitten by the tick, an infected tick, but there's something about the genetics of a gray squirrel that they do not get infected. In other words, so it cleans the, it doesn't pass the infection off.
It clears the
Whereas,
infection.
whereas I've read that chipmunks, for example, are get infected like we would get infected.
Right. And then there's some studies that indicate that certain dogs will recover the infection without any assistance as well. So I think the question on that is I from what I've seen, we don't have good enough data. There are people that I know are Lyme positive and have no symptoms. So then you would question the fact, are they clearing the infection? So I wish I could say, without reservation, absolutely it's this way. I don't think we have that kind of data that I could say with confidence that this is the way it is because it's incredibly variable as far as some people tremendous symptoms, some people not at all. And as we learn more, what we're also learning is Lyme isn't the only game in town. Like I showed you all of those. 20 years ago, it was just Lyme. And now it's this whole host of possible infections, right? So again, strengthen your immune system, eat naturals, be thoughtful when you go out as far as prevention, right? Do tick checks when you come back. There are ways to handle this, though. The worst thing that could happen is that we get so scared of going outdoors that we lose our joy of where we live, right? Yes. Golden seal is an antimicrobial, as is the tea tree. I use the tea tree specifically for anti-strep and anti-staph because those are common bacteria on the skin. The golden seal is more so for the bacteria for the possible co-infections, right? And the bentonite is to be able to pull. Okay. What's that? How dark are they? No, they're really not. I can kind of show you. They're pretty brown. I mean, the tough one for me is not the brown leg one. Those are pretty obvious. Here we go. And you can see, yeah, some of them can be dark brown. You definitely want to put them under magnification. On this, you can see some of them. There's a Western black leg, okay, and that one obviously black. But if you take a look at these, they're pretty definitively brown. The tough one for me is the larva, right? That larva guy, those can be almost translucent. Oh, okay. Yeah, so what you want to do is you want to put it under magnification, turn it on its back because when they're engorged, you really can't see the legs, right? And then you take a look at the bottom. Again, save the tick and send it in. And when they send it back to you, they're going to give you a report saying, this is a wood tick, we didn't have any concerns. Or this was a deer tick, and here are the concerns that we tested for. So if you're not sure, make sure that you get somebody that can test for it. Okay. Oh, okay. Well, it's something you want to test for because, again, so nobody argues any of the other spirochete infections that last chronically. Everyone knows they do. And Lyme is in the same category. Of course, it lasts chronically. The question is, how do you deal with it? Right? And there are definite ways to deal with it. And we just have to be thoughtful. And then the thing that I would encourage is that if you find something that works, share it with others. This is how people grow and learn, right? Because there are really no schools that I'm aware of that are really teaching a lot of this. We're having to try to glean the information ourselves. Pariarco tea? Pariarco has very strong antifungal properties. I've not read anything specific for it to be able to have anti-tick properties, but I see a lot of times people will have both. They'll have fungal infections and they'll have tick infections. And so if you deal with one, you strengthen the immune system to deal with the other one. So, and I like Pariarco tea, so it's a reason to drink it, right? Okay, okay. Any other questions? Padiarco tea. It's yeah, it's very good for certain things. Very good. All right, let's pray. Father, thank you for a time to be able to discuss, but let us not get so overwhelmed in disease that we forget that we need to overcome evil with good and that you will allow us to do so. Make us wise, teach us how to encourage one another, and Lord, give us the understanding of how you would have us proceed as a people and individually, so that we could live the message you have for us of health and vibrance and joy, and that we could encourage others to walk that same path. I pray that you bless each one of us with